Mary, I'm so happy that you're joining us today to talk to us about your work. And please introduce yourself where you are in the world. That's always of interest.
Yes, thank you for inviting me. I'm here in Tucson, Arizona. An integrative physician with a specialty in psychiatry.
Fabulous. Well, could you say a little bit about what that actually is? Because some people haven't even heard of an integrative psychiatrist. So how is your approach different than a conventional psychiatrist?
I'm more interested in causes, not symptoms. So lots of people know immediately they have the feeling of depression and they immediately say, I'm depressed. And what depression is, it's a symptom. It's one symptom. There may be many other things going on, but it takes someone skilled perhaps to bring out that there's also fatigue or anxiety or joint pain, insomnia. So they're all symptoms. And when we have a lot of symptoms, then the point of an integrative psychiatrist is looking for causes, is not immediately saying, you're depressed, therefore we have a drug for you, an antidepressant, and that's your treatment. It's looking and saying, what could be the cause? Is it depression? Did someone die? Do you have problems with your gut? Do you have some sort of infection? Do you have hormone problems? You're looking at many different causes. So that's what a psychiatrist would do.
And do you take blood samples and do blood analysis as part of your looking for the causes of depression, anxiety, and other issues?
Just about always, yes. I think that to diagnose depression with at least looking at hormones, if a person's around their 50s, male or female, you really want to know, hormonal changes for menopause or andropause in men are very common. Thyroid disorder is very, very common, autoimmune thyroid, and adrenal fatigue where low cortisol is a problem. There may be other things behind those changes too, but to diagnose depression with that, looking at hormones and nutrient status like magnesium and zinc is really not sufficient in my mind.
Tell me, did you learn this in medical school? Because I don't think most conventional psychiatrists are doing the kind of work that you're doing, so it's quite different.
No, it's not taught. It is actually taught in medical school. It's taught when you see a patient, you should actually listen to them and take a history and do a differential diagnosis and think about different causes of what's going on. That's really the way medicine is taught, and that's the way you learn it as a medical student. By the time you get to be an intern and a resident, and you have patients just lining up outside your door, and you're not going to sleep till you finish them, you learn, tears plus feeling sad is, Prozac. And that's pretty much what you do because you just don't have the time to listen and take a full history and do a differential diagnosis. So it is taught, but it's just not as commonly practiced, and it's less and less practiced with all the insurance changes we have going on.
Yes, and then you also, I think, went on to take training in this that would support the kind of work that you're doing. And from our previous discussions, it's obvious that you keep learning.
Yeah, I've done a lot of extra training because the people who know a lot about this stuff are not necessarily in psychiatry. So I've done a lot of integrative training. I have a board certification in holistic and integrative medicine. I have another certification in homeopathy. I have certifications in biotoxin illness, and I've gone to a lot of conferences, and I'm always looking for new things, particularly nutritional or infectious, that can be causing depression and anxiety as major symptoms.
Well, I'm struck by what a leader you are in this particular field, always learning and wanting to bring the best to people. And I thank you for joining us today to tell people more about this kind of a resource. So I'll say goodbye for now, and then we'll speak to you later to go in more depth about what you're doing. Thank you so much.
Thank you.